Bismillahirrahmanirrahim. Bismillahirrahmanirrahim. Assalamu alaikum. My name is Tasneem Aslam. I am a student of MS Chemistry from UMT. Today, my topic of presentation is bladder surgery. First, I will discuss about bladder surgery. Abstract. Bladder surgery, a diverse field within urology, encompasses various procedures addressing conditions from cancer to functional disorders. Major surgeries like cystectomy involve the removal of part or the entire bladder, often necessitated by malignancies. Cholecystectomy, urinary diversion procedures, redirect urine flow prompting a need for an understanding of the chemical implications involved in maintaining physiological balance. Transurethral surgeries, notably Herbert, focus on addressing tumors or abnormal tissues through the urethra, demanding a grasp of biochemical nature of these anomalies, bladders, augmentations, and other facets explore the enlargement of the bladder using tissue grafts, necessitating an exploration of the chemical compatibility of graft materials and their integration into existing bladder structures. In a sense, our comprehension of bladder surgery for a chemistry students involve delving into biochemical underpinning of bladder conditions, the chemical aspects of surgical materials, and intricate processes through which these surgeries restore or augment bladder functions. Next, we will discuss about what is bladder surgery. Bladder surgery is a procedure on your urinary bladder or the organ below your kidneys but above your urethra that houses your pee. The type of bladder surgery depends on what's being treated. Conditions that may need surgery include bladder cancer, cystulose, fallen bladder, or bladder prolapse, urinary incontinence, loss of bladder control. And the next is what are the types of bladder surgeries? Most bladder surgeries are now done robotically, meaning that your surgeons will just make a small number of incisions and then place pots that allow the use of robotic arms to perform the surgery. Few are open surgeries where there's longer types of surgeries include uterotomy. Sometimes reconstructive bladder surgeries is needed or desired for people who have lost their bladder in a procedure called a uterotomy. A segment of your intestine is removed and reattached to your ureters. This leads urine from your kidneys to an opening stroma near your belly button. A light leak bag is attached to the stroma to collect urine. The bag can be emptied as needed. The next one is new bladder uterostomy. Segment of your intestine can also be formed into a small pouch or a large new bladder. The pouch or bladder is placed in the cavity left by your bladder and stores urine. Again made from your intestine leads to a stoma in the abdomen, but in this instance, a valve allows the pouch to be drained whenever you wish. No bags are involved. The new bladders may be attached to your urethra to allow urine to drain normally. Bladder cancer is the most common reason for people to undergo bladder surgery, depending on stage and progression of bladder cancer. Surgery can be used in combination with other therapies such as chemotherapy or radiation therapy. To treat bladder cancer, many different types of procedures may be done. These procedures include radical cystectomy. This procedure involves the complete removal of your bladder. An incision is made in your abdomen and the bladder and adjacent organs are carefully examined to determine the status of cancer and see if it may have spread to adjacent structures and organs. Your bladder is moved along with any other affected organs. Next, I will discuss about bladder surgery techniques. Robotic assisted bladder surgery utilizes robotic system for enhanced precision and control during surgery. Minimally invasive cystectomy involves smaller incisions, reducing trauma and promoting quicker recovery. Next, I will discuss about bladder processing and bladder preserving therapies. New bladder reconstruction. Patient of a new bladder using intestinal tissue to preserve bladder function. Endoscopic laser therapy uses lasers to treat bladder conditions through minimally invasive procedures. Bladder preserving therapies are approaches used to treat bladder cancer while preserving the bladder itself. They often involve a combination of treatment such as transurethral resection of bladder tumor, that is TURBT, radiation therapy, and chemotherapy. TURBT is a surgical procedure to remove cancerous tissue from the bladder lining. Radiation therapy targets cancer cells with high energy rays, while chemotherapy uses drugs to kill or inhibit the growth of cancer cells. These therapies aim to avoid radical cystectomy, removal of entire bladder, and maintain bladder function. They are suitable for certain types and stages of bladder cancer, often a more conservative alternative to surgery, while still striving to achieve effective cancer control. Patient-specific factors, including the stage and the grade of the cancer, influence the section of bladder preserving therapies. Regular follow-up and monitoring are crucial to assess this treatment response and address any potential recurrence. Next, I will discuss about augmentation cystoplasty, surgical procedures to increase bladder capacity, often used in cases of decreased bladder functions. This procedure is often performed in cases where bladder has been become too small or rigid due to conditions such as urogenic bladder dysfunctions, interstitial cystitis, or congenital abnormalities. Next one is laser lithotripsy for bladder stone. It involves using laser energy to break down bladder stones into small fragments for easier removal. Laser lithotripsy is a procedure providers use to break up and remove stones in your kidney, bladder, ureter, and urethra. It's usually done by putting a laser through a scope in your urinary tract. Afterwards, it's common to have blood in your pee and discomfort from the stand. Laser lithotripsy is usually more effective than shockwave lithotripsy. Intravesical therapy. Treatment administered directly into bladder. Often used for conditions like bladder cancer. This approach is used when condition primarily affects the lining of the bladder. Next one is advanced imaging techniques. Utilizes cutting-edge imaging methods such as MRI or CT scans for detailed visualization of the bladder and stowing structures, enhanced recovery after surgery, multidisciplinary approach to optimize preoperative, intraoperative, and postoperative care, improving recovery outcomes. Enhanced recovery after surgery is a comprehensive, evidence-based approach to perioperative care. It aims to optimize the entire surgery from preoperative preparation to post-operative recovery with the goals of reducing complications, speeding up recovery, and improving overall outcomes. Key elements often involve preoperative education, minimally invasive techniques, optimized pain management, early mobilizations, and targeted nutrition. The approach involves collaboration among multidisciplinary teams to customize care plans for individual patients and specific surgical procedures. Next one is chemistry of stones and reasons for formation. Bladder stones can come form due to factors like concentrated urine, urinary tract infections, or metabolic disorders. Stones are composed of various minerals including calcium, oxalate, and uric acid. Next, I will discuss about side effects of techniques. Side effects can vary based on specific procedures but may include temporary discomfort, infection risk, or changes in blood function. And first one is surgery. Common side effects include pain, swelling, bruising, and scarring. Surgical procedures also carry risk of infections, bleeding, and anesthesia-related complications. Second one, medication. Side effect of medications can range from mild to severe and may include nausea, dizziness, allergic reactions, or more serious complications. It's important to be aware of potential side effects and consult with healthcare providers if any arise. Next one is radiation therapy. Side effects may include fatigue, skin changes, localized pain. Long-term effects might involve damage to surrounding tissues. The specific side effects depends on the type and location of the radiation treatment. Next one is physical therapy. While generally safe, physical therapy can lead to temporary soreness and muscle fatigue. In some cases, incorrect exercises or excessive force may cause injury. Machines manufacturing and material chemistry. Surgical machines are manufactured with materials ensuring durability, sterility, and compatibility with medical standards. Material chemistry focuses on selecting materials that are biocompatible and suitable for medical application. For more in-depth understanding, it's recommended to refer to academic literature, medical journals, or consult with experts in the field. Causes. Bladder stones are often caused by and other urinary system problems such as bladder diverticulum. Second one is blockage at the base of bladder, enlarged prostate, PBH, urogenic bladder, urinary tract infection, UTI, incomplete emptying of the bladder, foreign objects in the bladder. Almost all the bladder stones occur in men. Bladder stones are much less common than kidney stones. Bladder stones may occur when urine in the bladder is concentrated. Materials in the urine form crystals. These may also result from foreign objects in the bladder. And the next one is symptoms. Symptoms occurs when the stone irritates the lining of the bladder. The stones may also block the flow of urine from the bladder. Symptoms may include abdominal pain, pressure, abnormally colored or dark colored urine, blood in urine, difficulty urinating, frequent urge to urinate, inability to urinate except in certain positions. Interruption of the urine stream, pain, discomfort in penis, sign of UTI such as fever, pain when urinating or need to urinate often. You may be able to have small stones pass on their own. Drinking 6 to 8 glasses of water or more per day will increase urination. Your provider may remove may remove stones that do not pass using a cystoscope. A small telescope will be passed through the urethra into bladder. A laser or other device will be used to break up the stones and the pieces will be removed. Some stones may need to be removed using open surgery. Drugs are rarely used to dissolve the stones. Causes of bladder stones should be treated. Most commonly, bladder stones are seen with PBH or blockage at the base of bladder. You may need surgery to remove the inside part of the prostate or to repair the bladder. And the next one is, and the last one, outcomes. Most bladder stones pass on their own and or can be removed. They don't cause permanent damage to the bladder. They may come back if the cause is not corrected. Left untreated stones may cause repeated UTIs. This can also cause permanent damage to the bladder or kidneys. My topic is completed. Thank you so much. And Allah Hafiz.